Hi, and welcome to the year's first episode of the IJA podcast. This is your host, Gayatri, and with me is Rashmi. And together, we wish all our listeners a very happy, happening, and a prosperous new year. Now, as is tradition, the January issue of the IJA is a postgraduate focused edition. And without wasting much time, I welcome the man with a mission, the editor in chief, Dr. Rakesh Garg. Dr. Rakesh, welcome and thank you for joining us.
Thank you, Dr. Gayatri, and wishing
Dr.
everybody a very happy new year for the IJA readership, and let this year be full of academics and good clinical practice.
Dr. Rakesh, is the new year a time for new beginnings and new resolutions? Can I ask you whether, as editor-in-chief, you have any resolutions for the new year for the journal for this year?
I'm sure that what my predecessors for the IJA has taken it to a global height. I think that legacy will continue for 24 also. And I'm sure that with the support of all of us from the ISA headquarters, from the authors, the reviewers and editors, I'm sure that IJA would be able to publish landmark articles and which is going to improve the clinical practice across the globe.
So we are out with the first issue for the year 2024. And like I said before, this is a postgraduate focused issue. Would you like to share with our listeners what lies in store for them this month, Dr. Rakesh?
Absolutely. I think this January issue of Anaesthesia is bringing a compendium of the expertise from many of the renowned authors across the world. And it is very nicely themed, as you rightly said, that we definitely worked on teaching and training. We want our young budding anesthesiologists to excel and provide the best clinical services. So in continuum of it, we understand that simulation is emerging as the modality of teaching training. So we are coming up with good, interesting articles that will take care of various aspects of simulation, including crisis resource management, communication, simulated patient programs, how to establish a simulation center, definitely the involvement of simulation for airway management and other aspects. And definitely when we talk about the low resource settings, we do talk about simulation even in low resource settings. It's not so costly. And definitely we all are a little more glamorous about the use of artificial intelligence. And that's why this theme issue will also cover the role of artificial intelligence and technology in the field of perioperative medicine. And I'm sure that going through these articles, all the readers will be more wiser to use these modalities into a day-to-day clinical practice and include them into teaching and training, which is one of the mandate of National Medical Commission as well. And I'm sure that the budding anesthesiologists will be at par with other country where this teaching training program in the field of anesthesiology is going on.
Thank you very much, Dr. Rakesh, for sharing your resolutions for the new year with us and introducing the January issue to all our listeners. Now, let's see what Rashmi has in store for all of us this month.
Hi, everyone. Moving over to the first article, I would like to introduce the author of a very interesting article on perioperative crisis resource management in simulation training in anesthesia, Dr. Dinkar Pai, who is at present the Professor of Surgery and Director of the Simulation Center at Mahatma Gandhi Medical College and Research Institute, Shri Balaji Vidyapeeth, Puducherry.
Thank you, Dr. Rashmi. I'd like to thank the IJA and especially the Chief Editor, Professor Rakesh, for having given me this opportunity to contribute to this very, very important and I would say timely edition of the journal.
Now, moving ahead with the questions, patient safety has been the backbone of anesthesia practice ever since its advent. Do you think training in ACRM has increased relevance, especially in current day clinical practice?
In a short answer, I would say definitely yes. It is much more relevant now than it was in the past. And I would say there are two primary reasons for this. The first is we all know that patients are now much more aware of their rights. And we cannot lightly get away with patient safety errors as was happening in the past, where patients were probably more ignorant. And so I think it's very important to train our residents in aspects of patient safety. And the second reason why it's important now is, of course, that there is availability now of technology which allows us to train these people in the simulation center which probably was not as pervasive in the years earlier gone by.
Right. Doctor, often in a crisis, there is an interplay of numerous factors like medication errors or communication lapses and many other human-related factors. So the role of simulation-based education in skill development is very well established. But is it effective in training of non-technical skills as well? And what are the common barriers you come across?
So I think you rightly pointed out that there are most of the medical errors that happen, and especially I would say in anesthesia, are multifactorial in the very origin. And this is something that Reason has mentioned in his effective, that very elegant, I would say, Swiss cheese model, where all the holes in the slices of Swiss cheese have to line up for an error to finally happen. And the others are just latent errors. But unfortunately, all of us face full errors sometime with the adverse patient effect. So I would say that simulation is very effective in training for prevention of these errors. In fact, if you ask me as a simulation enthusiast, I would say it is probably the only safe way without compromising on patient safety of teaching our residents or training our residents to avoid these errors. In terms of barriers, I believe that as far as our country is concerned, the main one is a lack of awareness of the availability of simulation as a modality to teach these, to prevent these errors. And hopefully the addition of the journal will go a long way in improving that. The other barriers are, there's a lack of faculty expertise in the area of team training and simulation, especially in the art of debrief. And last but certainly not the least, if we want to have a consistent exposure of this training modality to our postgraduates, we need to have it integrated into the curriculum. Without a curricular integration, it's not going to happen.
Well explained, Doctor. Moving ahead, simulator technology has grown leaps and bounds. Now, with the availability of high fidelity simulators and integration of AR and VR simulators, etc., is simulation training possible in places that do not have any access to this technology and in resource limited settings as well?
Again, the short answer is yes. Regardless of what the simulator companies tell you, it is very well possible to do simulation with very low cost equipment, maybe even to the extent of just a few hundred or a few thousand rupees. All you need is a mannequin, which could be just a mannequin without any other features, like even a doll. And we have now various downloadable software monitors, which can be used to mimic clinical situations in these mannequins. And I have personally experienced this, and I've seen that it can be a pretty realistic experience for the students. This is not to decry the use of high fidelity or high technology simulators. They have their place, and the more senior our learners are, the more they want a certain degree of realism, and therefore it has a place for them. But that does not mean that we cannot conduct simulation with low technology, with low resource in a low resource setting. And if I'm right, there is probably another article in this very same issue which deals specifically with what are the low technology, low cost resources that we can use for simulation training.
Lastly, Doctor, do you believe that simulation training should be an integral part of our residency programs? And if so, many programs in the West have made it mandatory. Do you foresee it happening in the very near future in India?
I would say definitely it is to be an integral part of our residency program. And I think it is anesthesia which should take the lead, because the world over, it is anesthesia that has taken the lead in incorporating simulation into their residency training. And as you rightly said, it is not only made mandatory in many centers in the West, but it is also now a mode of assessment. Even in the US, if I'm not mistaken, the maintenance of MOCA examinations, the people who are undertaking the MOCA examinations are given a choice of whether to have a simulation-based exam or whether to have the regular exam. So even in assessment, it is having an important role. As far as it's happening in India is concerned, I can see a tremendous swell of support for this modality of training in India over the past few years, and this is increasing in a geometric way. A lot is because more and more faculty are there in India now who are aware of this mode of simulation and who are trained in this mode of simulation. There are simulation societies. There are individual institutions which are taking a lead. But on the flip side, I believe that we still have a long way to go, and we have to propagate this message across to all our anesthesia colleagues in different institutions, and even more so in the corporate hospitals, to take up this modality of training for in the interest of patient safety.
Thank you, Dr. Dinkapai, on sharing such knowledge and message about simulation. Next, we have another informative article on simulation by Dr. Aruna Parameshwari on establishment of a simulation center, the challenges and solutions. Dr. Aruna Parameshwari is currently the professor and head of the Department of Anaesthesiology and Pain Medicine at Sri Ramachandran Institute of Higher Education, Chennai. Welcome on board, Dr. Aruna.
Thank you very much, Dr. Reshma. First of all, I would like to thank the Indian Journal of Anaesthesia and Dr. Rakesh Garg for this opportunity. It's a fantastic idea. I'm very happy to be a part of this. Thank you.
Thank you, Dr. Aruna. Dr. Aruna, what are the qualities of an ideal simulation training model according to you?
An ideal simulation training model should first of all have a realistic setting. For example, if we are looking at training an anesthesiology resident on some aspect of care in the operating room, we first of all need a setting that looks like a real world operating room with a real looking patient. So the recreation of this reality or fidelity is very, very important for the success of simulation. And that I would say is one of the most important qualities of an ideal model. The other qualities are that the model should allow for repetitive training, high quality training till mastery is achieved, and the model should be sustainable. So those will be the ideal qualities.
Doctor, what are the challenges in establishing such a model?
The foremost challenge is the availability of resources, both human resource and material resource, like the space needed, the equipments needed, and the finance that is involved in procuring this. And convincing the organization to buy into the idea of setting up an ideal simulation center model is a huge challenge. The other challenges are to standardize and provide the best practices in the design and the delivery of the program, and also constant evaluation of the program to see if outcomes are met. So I would say these are the most important challenges in establishing an ideal training model.
Doctor, rightly when you're talking about the resources, about setting up of resources, you highlight the importance of having the right team and say it must preferably be interprofessional. Could you elaborate on that?
In practice, all of us do not practice as individual entities or as silos, but we work in multidisciplinary and interprofessional environments. Like we have physicians, nurses, technologists, administrators, students, they are all part of our working team. And an effective collaboration among these team members is very much essential to ensure high quality of care. So simulation allows such an interprofessional education where learners can have a shared experience and everyone will be able to achieve shared learning outcomes or goals. So interprofessional teams and interprofessional education is very, very important, and simulation offers a way for this.
Doctor, how difficult is it to get the faculty away from their clinical responsibilities to participate in such simulation training? And how does your department go about staff scheduling?
It is very difficult to get faculty to participate in simulation training because many trainers are full-time healthcare professionals and only part-time simulation trainers. So we need to consider this factor in staff scheduling for the simulation center. The best way to do this is to rotate them between clinical work and the simulation center work. For example, the in-charge faculty can just do 1 or 2 days a week in clinical areas and the rest of the week in simulation center. Similarly, the other trainers can actually be rotated between the clinical work and the simulation center work. Though this may seem difficult, with proper planning, this can be achieved.
Yeah, that's a good balance between both clinical and simulation rotation. Now, the article talks further about simulation center design and budgeting. And then you talk about the scope of a simulation center apart from its basic skills training for students. Can you shed some light on this, please?
So the scope for training that a simulation center provides is, in fact, quite huge. It's quite immense. It not only helps with basic technical skill training of students, but also helps in fostering non-technical skills like communication, situational awareness, teamwork, and leadership skills, which are actually very important to reduce medical errors and improve the quality of care. So I would say that simulation training imparts knowledge, It imparts technical skills, it imparts non-technical skills, it imparts the right attitude, and it helps in overall quality improvement of the healthcare organization. So what simulation offers is over and above and much beyond just a basic skills training for students. That's what I would say.
Thank you, Dr. Aruna, for giving us an idea about the practicality of simulation centers. As you all have observed, we have had 2 articles in this issue shedding light on different aspects of simulation and its importance. Gayatri?
Thank you, Rashmi. It's our greatest pleasure and honor to have with us our immediate past president, Dr. M.V. Bhimeshwar. Welcome to the podcast, Dr. Bhimeshwar, and thank you so much for joining us.
Yeah, thank you very much, Dr. Gayatri. Happy New Year to everyone.
Wishing you a happy new year as well, sir. Dr. Bhimeshwar, you've been the president of ISA last year, and I must congratulate you on a very successful and brilliant term. This year, you are the academic chairperson of ISA. Do you think the manuscripts published in IJA will help clinicians modify their practice to ensure best outcome for their patients?
Yeah, definitely, yes. All the manuscripts will be definitely useful for the people who are reading it. But I must tell you, ever since the Indian Journal of Anesthesia was started way back in 1953, and I have been closely following the journal since 1992. There have been several editors, Dr. Akramlal, Dr. Basu, Dr. Kotu, Dr. Harsu, Dr. Balabhaskar, Dr. Divetya, Dr. Lalit Mehndiratta, Dr. Muralidhar Joshi, and presently Dr. Rakesh Garg. Everyone has put in their tremendous effort in bringing laurels to the IJA, and the Indian Journal of Anesthesia has improved by leaps and bounds because of the tremendous effort put in by all these editors-in-chief and their meticulous planning and selecting of their peer reviewers. This is the main backbone for the Indian Journal of Anesthesia, and the hard work. Definitely, their hard work is shown, and all the people who are reading this IJA will be benefited by these manuscripts.
Yes, absolutely, sir. Do you feel this postgraduate focus issue will contribute towards improving teaching and training among anesthesiologists in India?
Yes, definitely yes. In fact, the postgraduate issues were started by Dr. Kotur when he was the editor-in-chief. And then ever since that, everybody used to wait eagerly for the postgraduate issue. And everybody has a collection of these postgraduate issues. And they were very, very popular. They a theme-based selection of the topic. And everybody was meticulously following. And now this year's theme as well, selected by Dr. Rakesh, simulation, artificial intelligence and technology in anesthesia, is another landmark, I should say, because these are the latest topics, the recent advances in anesthesia. So I'm sure all the people, postgraduates especially, will have a tremendous reading of these articles, and it will be their collection. The IJA will be a collection for all these postgraduates, and they'll do very well. Definitely, this is part of their curriculum itself. So they will be definitely benefited. And with others like Dr. Aruna Parameshwari and Dr. Pai, I am sure they will have a wonderful, it's a feast for them. Thank you.
Absolutely. Yes, absolutely, Dr. Bhimeshwar. Thank you so much for your insights, and thank you for briefly taking us through the history of the journal, which a lot of us are not aware of. Thank you so much for joining in. It was really a pleasure to talk to you.
Yeah, thank you. And one more thing is, the popularity of the journal, ever since I have been following since 1992, is that all the editors-in-chief, except for Dr. Pramila Bajaj, have become the presidents. So you can see the popularity of the editors-in-chief. Thank you.
Okay, thank you. It's really a lucky day at the podcast today because we are greatly fortunate to have our second guest, who is not only a stalwart academician, but also the current president of the Indian Society of Anesthesiologists, Dr. J.V. Devatya. Dr. Devatya, welcome to the podcast, and thank you very much for joining us today.
Thank you. Thank you for having me on your podcast. Your podcasts are a great initiative, and I'm really happy to be part of this. And I hope this takes the journal and the ISA further and higher.
Dr. Divatia, you've taken over as the president of ISA, and we all know you as an academician par excellence. Can I ask you what your vision is for academic activities under the ISA banner this year?
So, while we are academicians, when we talk of the society, we are also talking of members. And of course, there are 3 or 4 main sort of headings that I would sort of look at. One is professional excellence, and I think that is the core mission of the ISA and anesthesiologists, and that is to provide excellent anesthetic and perioperative care and safety of our patients. So, and professional excellence encompasses staying updated with our knowledge, skills, and practice patterns, right? So that's obviously going to be one of the core things that the ISA is going to do. And we have to help our members at all levels, whether they're PG students, early career anesthesiologists, mid-career, senior anesthesiologists, corporate anesthesiologists, remote and rural areas, practitioners, freelancers. And we have to have something for all of them. But I know it's a challenge for that,
Yes.
but we already have a number of online resources. And I think the power of technology, of online technology, helps us reach an audience that we are never able to reach earlier. So we've got, postgraduate CMEs or online postgraduate CMEs, which happens every Monday. In fact, we've just finished one today. We have something called the CLIP, clinical practice webinars, every alternate week. We have something called the CRISP, that is clinical reasoning and problem solving. Again, these are for practitioners and senior and practicing anesthesiologists. The IJA ISA REAP, the ISA IJA REAP, it's a research and practice, research and publication webinars. These are also an extremely valuable online resource. So these things will continue. We have all our city branches and state chapters having their CMEs and workshops and PG assemblies, which the ISA funds. And also, I think more than 20 to 30 in a year, the ISA is going to fund in various parts of the country, especially in the not so resource rich places are also targeted. We are also targeting a CME in the Northeast. So we are going to sort of spread our wings as far as education is concerned. Of course, we have a state conference, a national conference, Patna, which is going to be very, hopefully we'll have new sessions, innovative sessions, and hopefully we'll be able to keep the crowd inside the halls so that they benefit and eventually our patients benefit.
Surely looks like a very exciting year ahead. Do you foresee the IJA playing an important role in advancing academic research in anesthesia in the new year?
I think the IJA is the face of the Indian Society of Anesthesiologists to anesthesiologists in India and the world. And I think, therefore, the IJA is a vital cog in the wheel of all the plans that we have. And of course, being a journal, it focuses on research and focuses on publication. So there are 2 or 3 benefits. One is the postgraduate issues. They are beneficial for postgraduate students and others. So I think this issue is also going to be a postgraduate issue, and it's a sort of series of review articles which come up. The IJA is indexed, and not only is it indexed, but now it's got a very respectable impact factor of 2.9. And that should be a great source of inspiration for anesthesiologists in India, because it gives us an opportunity to publish in a highly respectable journal. This sort of, we've never had this kind of profile before, and all the current editor and the previous editors have to be complimented for allowing the IJA to reach this. Now,
absolutely,
this will encourage research, good research and good publication. And what I would really like to see, when you say that IS is a big society, what is our standing in the world? You can say you've got 40,000 members, but ultimately people will ask, what is your scientific achievement? And that is judged by the publications. The IJA is giving us a platform, and we must use this now to publish in the IJA. It will help us sort of elevate our profiles as well as that of the ISA and the IJA. So I would like to see more multi-center research coming in. I'd like to see more collaborative research coming up, more randomized controlled trials. I think Dr. Rakesh Garg has started publishing systematic reviews, and I'm very happy to see systematic reviews and meta-analysis being published 2 to 3 every month almost. So I think that's a great step. So I think the IJA is the face of the ISA, and I really would like to see research taking it forward. And we don't have to look very far to get published in a good journal. Our impact factor is 2.9. Indian authors, Indian researchers must do good research and publish in the IJ. And we have a platform ready-made for us. And I would really encourage everyone to avail of this opportunity.
Yeah, and a platform that we can all be really proud of.
Absolutely.
Yes. So this issue is focused on simulation, artificial intelligence, and technology in anesthesia. Do you think, due to its relevance in today's time, it is going to benefit the readership of the journal?
I think all three issues, simulation, artificial intelligence, and technology, that's the future, right? Simulation is going to be the future of teaching. Simulation is going to be the future of crisis management. It's going to be the way how we learn to deal with different situations which cannot be which are uncommon, and which you cannot practice every day, and that sort of thing. So I think simulation is fabulous, and of course it has some limitations, but there's no better teaching technique or tool or this thing than simulation and so on. So that's important in the way we learn and the way we progress in our practice and the way we manage crisis. Artificial intelligence is the buzzword, and a lot of and artificial intelligence has a great promise for the future. It's going to make life easier. It's going to help to think or do things which faster than the human mind can think. It can aggregate huge amounts of data which the human brain just cannot. So there is tremendous potential. So I think we must all be very excited and look forward to artificial intelligence in shaping our work, our practices, and our lives in future. But at the same time, we must also be aware of the limitations of artificial intelligence. I think a lot depends on the kind of data that it aggregates. A lot is dependent on the algorithms that humans are going to sort of compute and give. All the decision making is based on many of the thought processes that us humans are going to give. And depending on the kind of data and the kind of algorithm and the kind of clinical inputs that come in, artificial intelligence could do wonders, or maybe it might not be so great. So we need to be aware of the limitations of artificial intelligence as well. So I think an issue which includes artificial intelligence and its relevance and limitations and the potential is something which all of us should be aware of. And so including that, technology is, all over, right? The way we are speaking now is technology, and technology is inseparable from the way we live and the way we work. So I guess it's a very relevant theme, and I'm sure it will be explored, and not just students, but every practitioner and every anesthesiologist, maybe even non-anesthesiologists will benefit from an issue like this.
Yes, and I think anesthesia being such a dynamic, specialty, our working environment is so dynamic and quickly changing. There's a long way for us to go in artificial intelligence, but then I think it looks very promising, especially after having read all the articles in the current issue. Thank you so much, Dr. Tewatia, for sharing your thoughts and your visions for the year. And I wish you good luck in your term as president. And we hope to see the ISA and the IJA growing under your leadership. Thank you very much once again for joining us.
All I can say is Tathastu. Thank you very much for having me again.
I just want to take a moment to thank you for listening right through and to express my gratitude for following yet another episode of the IJA podcast. Stay hungry and stay curious for many such very interesting and informative articles this year. Thank you all.